Welcome to Robert Wood Johnson University Hospital, Somerset's Health Talk. On today's show, we will learn more about how COVID-19 has impacted the Latino community in central New Jersey and Robert Wood Johnson University Hospital, Somerset's outreach efforts to help prevent the spread of the virus. I am Dr. Douglas Ashinsky of RWJBarnabas Health Medical Group's Warren Internal Medicine. The COVID-19 pandemic has disproportionately affected members of the Latino community. While 19% of New Jersey's population is Hispanic, Hispanic residents account for 30% of the COVID-19 cases during the first wave of this pandemic this spring. Death rates from COVID-19 have been higher nationwide among members of the Latino community. We are joined by Serena Collado, Director of Community Health Department at Robert Wood Johnson University Hospital, Somerset, and Paula Gutierrez, Director of Diversity and Inclusion at Robert Wood Johnson University Hospital, Somerset. In accordance with social distancing due to the COVID-19 pandemic, our guests will be joining us remotely via video conferencing. Thank you both for being here. Serena, can you tell us a little bit about yourself, your background, and what got you interested in Latino health at Robert Wood Johnson University Hospital, Somerset?
Well, first, thank you for having me, and I'd be happy to tell you a little bit about myself. I graduated from James Madison University with an undergraduate in public health, Eta Sigma Gamma, and then I have my master's in marketing here at Robert Wood Johnson University Hospital, Somerset. I'm the director of community health and the convener of Healthier Somerset. So in these roles, we really look at community needs, and we really try to address the community needs, ultimately to make sure that the community is healthy. We ultimately want to be one of the healthiest or the healthiest county in the state. So what got us really interested in Latino health is when you really look at everybody, all sectors of the community in Somerset County, you really need to focus on communities that are underserved, and there are health disparities. So as COVID approached, we really did see a need within our Latino community and a need for health education as well. So that is how I really ultimately got into, doing the outreach for this group.
Thank you. And Paula, you want to tell us a little bit about your background and also what got you interested in Latino health at Robert Wood Johnson University Hospital, Somerset?
Sure. Thank you, Dr. Ashinsky, for having us this morning. So I'm Paula Gutierrez. I'm the Director of Diversity and Inclusion here at RWJUH Somerset. I have a bachelor's in biology from NJIT and a master's in healthcare administration from Seton Hall. And one of the reasons why I have gotten into the work in diversity and inclusion, but also looking at underserved populations and health equity and making sure that we are addressing the different social determinants of health of our population is because I have a lived experience. My family is Latino. I'm first generation American. My parents are from Colombia. So I have very much been, within this community my entire life and have experienced a lot of the disparities that we're seeing right now, especially during the COVID-19 pandemic. So it's something that really hits home to me. And for us to be able to use our collective strength as a hospital, as an anchor institution, to really be able to support our community during the pandemic has been something that really is very close to home. So we're really excited to be able to help our own community during the pandemic.
Thank you. Thank you both for really telling us from the heart why the two of you are really doing this. And can you both tell us what you've seen locally as far as the impact of COVID-19 has been on the Latino community?
Yeah, so what we're seeing really primarily the fact that this community has a lot of different barriers that really, unfortunately, have led to the COVID-19 pandemic really disproportionately impacting not just communities of color, but also the Latino community. So when we look at why that is, you have things like language barriers, right? So English is not the first language, or probably, isn't even a language that a lot of these folks speak. So when we're trying to deliver any kind of education or communication about masking, social distancing, hand hygiene, it's important that we do that in a linguistically appropriate way, right? Because otherwise they're really not getting the information that they need. A lot of the individuals in the Latino community are essential workers. So they don't have the ability to work from home like many other individuals. And, in addition to that, they live in multi-generational households. So you have multiple generations living in the same house that are going out into the community, working and coming back home and potentially infecting other individuals. And they may very well be younger and asymptomatic, but they're coming in and infecting the older individuals. So there's a lot of, in terms of the cultural and the linguistic piece where there may be a lack of understanding. And that's really where we come in to make sure that we're delivering that information, in their native language.
So the importance is, again, English not being their first language, the language difficulty, and of course that's tremendous with everything. And the fact that many of them or a high proportion of the Latino community are essential workers and cannot take the time off and are therefore exposed to what we're currently being exposed to. They're being exposed to the same things that physicians, nurses, nurse practitioners, PAs, all of the people in the hospitals are, but may or may not have the PPEs that they do at the hospital. So therefore, they're being affected much more disproportionately than the average Caucasian.
Yeah, that's exactly correct. Yes.
Yeah.
And what has Robert Wood Johnson University Hospital Somerset done to help flatten the curve and bring them into line with what white Caucasians have?
So I'll field that one. So in the first wave, in April, we noticed that there was a surge among the Latino community. Approximately 70% of our patients were identifying as Latino. So what we immediately did is we immediately, worked with Paula and I teamed up using the bilingual staff from community health and members of our Salud BRJ. We immediately began making phone calls using community health's database and the hospital's database of patients, of Latino patients, to really inform them about how to stay safe and well in COVID. We simultaneously sent out letters, resource directories, and Robert Wood Johnson Barnabas Health marketing collateral that were culturally and linguistically appropriate, explaining again, how to be safe and how to stay well. So. That then led to us really finding out that by making these phone calls and through feedback from the Latino community, that really what the community needed to stay safe was resources, such as masks, hand sanitizers, things like that. So once again, around in April, we really began working with, not only internal departments, but external organizations to, with our outreach efforts. So we actually set up mask distribution events where we were going into the community and distributing masks, hand sanitizers, and educating the community on how to stay safe. So for instance, one of our very first outreaches, we were working with Bound Brook, and we really made an effort to focus on Bound Brook because this is a community that has a high number of Latinos residing in it and had a very high positivity rate. So in that first outreach effort, we really had, we did it at the Salvation Army, and we had a line down the pathway, down the street, and around the corner, and people just kept coming. And it was even larger the second time we went to Bound Brook, and we did it in front of the Dunkin' Donuts on Main Street. That line went down a whole block and then down another road. So, it really goes to show that in the first round, what the needs were. And we continue doing that outreach even to this day, up until this month, we continue to do that outreach. Within the second wave, we're finding a little bit different. We continue to do the mailings and the phone calls. But now it's, again, as Paula mentioned, the need to really just educate and have people adhere to what we call the 4 Ws. So, so really, again, keeping people safe. So that's what we've been doing. We also did form, and I think, Paula, you're going to get into it later, so I'm not going to steal your thunder, but we have been working with a lot of different community organizations to this day to really spread the word.
And what are the 4 Ws?
So the 4 Ws, so what our messages have been is that we want you to wear a face mask. We want you to wash your hands regularly, watch your distance, and when you're sick, stay home. And in the second wave, we're also kind of encouraging people for the holidays to stay within their own family pods, not to go to large gatherings, because that's where, again, we're seeing, a lot of positivity occurring. And that's really a challenge for our Latino community because they're all about family and getting together.
Now, do you want to say that in Spanish also?
Oh, my goodness.
Well, maybe Paul is better at that.
Puedo hablar un poquito, pero Paula se habla más mejor.
Yes. Por favor, recuerden lavarse las manos, utilizar su mascarilla, mantener la distancia, y si están enfermos, quedarse en casa.
Very nice.
Those are your 4 Ws in Spanish.
Okay, so the important thing, what we've learned is that with the public health outreach programs, using the cultural diversity and understanding that there's a large Latino population who don't have English as their first language. When you listen to the TVs, everything's in English and no one is explaining to the average person what we really should be doing. What you're showing us is through this public outreach and through the use of the local organizations and the use of Spanish as their language, we're able to get the message out to the important members of this community.
Yeah. Yeah, and Dr. Ashinsky, as a result of those efforts, we actually have now formed a Latino Advisory Council. So this advisory council is Somerset County Latino Advisory Council that is comprised of over 20 different local and government officials, folks from all different areas of the county and serve different sectors. So the role of this group is really to continue that education, to continue to keep our Latino community safe, but also they are trusted individuals within their own respective communities, whether it's clergy, freeholders, folks in education, in employment. So they already have a connection to the community because they are seen as a trusted individual, which then allows us to come in and speak with them or then further gives them the trust that they can come to the hospital, because another barrier is the trust barrier. A lot of the individuals in the Latino community may be undocumented. So there's a fear that if they seek medical attention, they may be deported or that they may not be seen. So having this Latino council to really, be sort of a speak on our behalf, to tell them, no, this is a trusted place that you can go to, has been really helpful. But we've also partnered with these folks to do a number of different webinars in Spanish. So we do about 1 to 2 webinars monthly in Spanish on a particular topic. We just did one with an organization around mental health in Spanish. And we've developed sort of a cadre of speakers that we can tap into depending on what we're seeing the need is. It may not be COVID related, but it's connected to COVID in some way. So we have a number of folks that we can tap into to sort of spearhead any of those messages. And we've also used our own staff to do videos for social media. So we did videos on hand washing and hand hygiene, just brief 30-second video, again, using our own staff so people can begin to trust our own, the hospital as a place that they can come to if they need help and support. So really just sort of having a holistic approach, again, hitting all those different social determinants of health about education, language barrier, cultural barrier, using our own internal staff to deliver that message and create that partnership.
Well, I definitely have to applaud you that you've basically formed something from nothing and made it the outreach so important, and that we're right now only doing this with COVID, but I assume that when we finally do get through this COVID pandemic, that you'll be able to use this in the future for other types of prevalent conditions in the Latino community.
Yeah, certainly. And I think it really speaks to the importance of the work that is done outside of the walls of the hospital. I think oftentimes, especially, when it comes to healthcare administration or even, public health, population health, you really have to get out there into the community. You're limited to the work that you can do, sitting at your desk. You have to get out there and be a presence, be a face, and really be with the people and let them know that they can trust us.
Well, what it again shows us is that the leadership of RWJBH and the leadership of Robert Wood Johnson University Hospital Somerset is thinking for not only today, but thinking about the future and how to improve the community aspects of health along with the health that is done within the hospital itself, and that the outreach of the hospital to the local communities is just as important as the health that we're doing within the communities.
Absolutely.
And the fact that they have people such as you who basically took nothing and made it into such a tremendous effort, that we're going to be able to get through this next surge with the Latino community, and you'll be able to help us with the Latino community and the barriers that still exist. And those barriers you think right now are?
I would say the biggest barrier right now is the holidays. And the fact that I don't think people really realize that we're in that second wave, because a lot of the businesses and everything is still business as usual, no pun intended, but things are still open and nothing is closed. So I think people have a false sense of security that we are not in the second wave, but in fact we are. So, in the holidays are a huge barrier because people will gather. And so we're trying to really encourage folks to, if you're going to gather for the holidays, to really just limit that to the folks that live in your household. And if you do decide to gather with a larger group, to mask and maintain your social distancing and wash your hands. But really, the message that we're trying to deliver is don't have any kind of large gatherings during the holidays, and really limiting that to your household, which for the Latino community is very challenging because we are a culture that thrives on family, especially during the holidays. So this is almost very counterintuitive and just not in our DNA. So that's really the messaging that we're trying to deliver right now, is that the way in which we show that we care about each other is really actually to keep our distance.
Again, important message that during these holidays, we would love this year's Christmas, New Year's to be like last year's, but it's not going to be like it. But hopefully next year it will be. And the way we get through this is the 4 W's. The 4 W's and trying to keep, unfortunately, this Christmas to a limited number of people.
Correct. And, we're offering people other suggestions. Some people can, with their cell phones, do Zooms, like a Zoom holiday, or if they can do a tailgate where they can go outside. I know it's getting colder, but, with Thanksgiving, that was, still an option. So, we're trying to offer them different suggestions as, we continue to make calls and speak to individuals. But yes, we're really focusing now on the holidays for sure.
Now, can you both tell us a little bit about other community outreach and social impact initiatives that you are using to target the Latino community? The Building Bridges to Better Health and others?
Sure. So in community health, we have several initiatives. There's Building Bridges to Better Health. We have El Poder sobre la Diabetes and Senos Sanos. So Building Bridges to Better Health is an initiative. It's a Healthier Somerset Coalition initiative in which we're looking to make Bound Brook and South Bound Brook healthy communities by addressing the social determinants of health. As I mentioned earlier, Bound Brook has a high number of Latinos residing in that community. So we really have been doing a lot of outreach, again, using bilingual staff, using culturally and linguistically appropriate materials to reach the community through various initiatives. So supporting them with various needs. We've provided those towns and children with masks. We've provided them with, school supplies. We've been sending food. We've given the town approximately $21,000 through our grant in ShopRite gift cards to support food insecurity and the food needs within the community as well. Because again, as Paula mentioned, in some cases, the Latino community really relies and needs that income. And that's why many of the family members have to go out. And, again, by them going out to work to sustain the family, they're coming home and can potentially give COVID to a loved one and not knowing they could be asymptomatic. So again, we're supporting some of those families whose work had to stop because of the pandemic. So again, we look at, so many different needs in those towns to try and help the community be healthy at every level. So again, using our contacts with that initiative, we have then outreached to churches. So we've been working with the churches, the schools, to really help spread the word, help also distribute masks and sanitizers if that's what is needed. We've also been giving out flu clinics. We've set up numerous flu clinics within Bound Brook and some of the towns that have a high Latino population within Somerset County. So that's just a little bit about our Building Bridges to Better Health initiative. We also offer El Poder sobre la Diabetes, which means the power over diabetes. It is normally it is a 12-week diabetes prevention and management program where we actually do outreach to the Latino community. We reach about 120 Latinos annually through this grant. We educate them on the importance of a healthy diet and exercise to prevent diabetes. We actually do health risk indicators. So meaning we do tests where we measure, blood pressure, A1C, cholesterol, BMI, and we set goals. The participants will set goals, and at the end of those 12 weeks, we retest them to see what improvements we make. So our program coordinator, Carolina Georgians, has great results. About 95% of those participants will improve at least 2 or more health risk indicators within that 12-week period. So it is a wonderful program, but we use those contacts to actually reach out. Carolina will make calls to all of her past and present participants about COVID and to educate them on how to prevent it and also see what the needs are in the community. So again, assessing what those needs are so we can help the community as well. With Senos Sanos, that means healthy breasts, and that is an outreach education program to our Latino women, where we talk about breast health and the importance of getting an annual mammogram. And then if after this education program, should a woman need a mammography, we help. We have a limited number of grant funds that could help provide a free mammo, and we also help provide them with resources to obtain a mammogram should they need one. So once again, all these programs over the years, we've established and collected names and have a database. And those, as I mentioned earlier, is the community health database of community members that we have built over time and are using to do many of these phone calls, the mailings to kind of assess the needs and also to do the education to prevent the further spread of COVID-19.
And Paula, do you want to add anything to that?
Yeah, sure. The hospital also has our Salud Business Resource Group. So this is a group that is through my office, through diversity and inclusion. And really a lot of the folks that went out and did this outreach were actually from our business resource groups. And it's a group of employees that come together that either speak Spanish or are members of the Latino community. So we have quite a number of folks here that speak Spanish that in various areas of the organization that are available should patients come in and need, whether whether it's radiology or whatever type of healthcare need they may need. There are individuals here that not only speak the language but understand the culture, which is an important piece of this outreach that we did. Right, we really leveraged a lot of our staff that was willing to go out there and help their own community. So we have this great group of people that are just fantastic and help our patients when they come into the hospital. So it truly is a labor of love.
Well, the two of you definitely really, you took nothing and made it into a tremendous community outreach to an underserved community, and a community that needed as much help as possible. You have to congratulate both of you for the tremendous amount of work, as well as, of course, the leadership that picked the two of you, that figured out how important something like this is, and to help public health by doing what you've done. Now, as we're getting closer to wrapping up the show, Serena, do you want to say anything that to the Latino community, both in English? Well, I'll have Paula do it in Spanish. What they should do to help protect themselves during this spread of COVID-19?
Yeah, thank you. I mean, I think, again, the important thing is to, really remember to protect yourself, wear your mask, again, the 4 W's, wash your hands, distance, and when you're sick, stay home. It's right now, it's really, until a vaccine comes out, it's really the best way to prevent the spread of COVID-19. And to think about it, even when they're at home, because as Paula mentioned earlier, many of these families live in small confined areas. So masking indoors maybe is as equally important as it is when you are masking outside. And so if you do have a cloth mask, make sure you're washing that regularly as well. And if you have a disposable, make sure that you change that regularly as well. And again, it is a way to contain that virus. So, Paula, did you want to add anything to it?
Yeah, I'll do some takeaways in Spanish. Recordarle a las personas que por favor utilicen su mascarilla siempre, lavarse bien las manos, mantener el distanciamiento social de mínimo de 6 pies y si están enfermos, quedarse en casa. Pero ahora más importante, durante las Navidades, por favor limiten estar juntos en grupos grandes, porque así es que vamos a continuar propagando el virus. Así que, por favor, manténganse en grupos pequeños con las personas que viven nada más en su casa. No vayan a ninguna casa, no tengan personas que hayan estado por fuera. Limiten, por favor, cualquier reunión grande. Sabemos que de pronto no queremos hacer esto durante este tiempo de las Navidades, pero si queremos estar juntos el próximo año, por favor, cuídense mucho y limiten las personas que tengan en su casa este año.
Eso perfecto.
Thank you very much, both of you, for being here. And thank you for what you do for both Robert Wood Johnson University Hospital, Somerset, as well as the Latino community and all of the communities surrounding our hospital.
Thank you for having us. Thank you so much.
Thank you.
Gracias.
Yes,
De nada. This concludes today's episode of Robert Wood Johnson University Hospital, Somerset's Health Talk. Please remember that the opinions expressed here by our medical experts are not a substitute for medical advice from your own physician. If you need a physician, please call our physician referral line at 888-724-7123. For more information about Robert Wood Johnson University Hospital, Somerset, please visit our website at www.rwjbh.org/Somerset.